Good morning, everyone. My topic for today's paper is the clinical microbiological profile of post-cataract surgery and endophthalmitis and the role of polymerase chain reaction in the management, which is a report from Eastern India. Endophthalmitis is defined as the inflammation of the inner coats of the eye resulting from intraocular colonization of infectious agents with exudation within the intraocular fluids. So early intervention with a targeted antimicrobial therapy is crucial for the effective management. The diagnostic techniques of staining and culture remain the gold standard, although the culture positivity rates vary widely, and therefore PCR can rapidly detect the microorganism and aid in selecting the appropriate antibiotic as well as the antifungal agent. The primary aim of the study is to provide a clinical and a microbiological profile of the post-cataract surgery and endophthalmitis from Eastern India, and the secondary aim is to elucidate the utility of PCR and its clinical implications in the management of the same. It's a retrospective case series ranging in a time period of 2015 to 2023. The staining, culture, and PCR methods were adopted. Intervention was based upon the clinical diagnosis and PCR positivity. Intravitreal antibiotics were administered. Vitreous surgery was done as and where indicated. The favorable anatomical outcome was defined as a clear media and attached retina. Favorable functional outcome was defined as a best corrected visual acuity of 20/200 or more. This is a tabulation of the demographic details, and we can see a total number of 132 eyes were taken for the study. The microbiology results have revealed that in a culture-positive patient of 51, the PCR positivity stood out to be 100%, and in a culture-negative patient of 81, PCR positivity stood out to be 70.4%, and this value was statistically significant. Amongst the 51 patients of positive culture, 21 eyes had a favorable anatomical outcome, and 18 eyes had a favorable functional outcome. Amongst the 81 patients with negative culture, 60 eyes had a favorable anatomical outcome and 58 eyes had a favorable functional outcome. And the difference between the culture positivity and culture negativity patients was statistically significant as well. Amongst the 81 patients with negative culture, there were two groups. Group A were the patients who were positive for PCR, and 51 eyes had a favorable anatomical outcome, and 50 eyes who had favorable functional outcome. And Group B were the patients who were negative for PCR, and those were 10 eyes where there were favorable anatomical outcome, and 9 eyes who had favorable functional outcome. So the whole cohort results have depicted that the favorable anatomical outcome was achieved by 81 eyes, and the favorable functional outcome was achieved by 76 eyes. So the most common gram-negative organism which was isolated from our study was Pseudomonas, and the most sensitive antibacterial agent now it is ciprofloxacin. And the most common gram-positive organism which was isolated from our study was Staphylococcus epidermidis, and the most sensitive antibacterial agent was vancomycin. So the commonest gram-positive isolate was Staphylococcus epidermidis, and the commonest gram-negative isolate was Pseudomonas. The gram-positivity sensitivity was highest for vancomycin, and the gram-negative sensitivity was highest for ciprofloxacin. So our study yielded a culture positivity rate which was lower than the studies by Gupta et al. From North India and Lalita et al. From South India, but it was similar to the studies by Sharma et al. From Eastern India. And the present study has found Pseudomonas species as the commonest isolate amongst the post-cataract surgery and endophthalmitis. So our study shows ciprofloxacin has replaced ceftazidime being the most sensitive antibacterial agent for a gram-negative microorganism. And the role of PCR comes into the play because it helps in timely intervention, since it is the cornerstone in the management of endophthalmitis. And PCR also renders the results earlier, thereby allowing the clinicians to intervene, and aids clinicians in instituting the treatment based upon the results of eubacterial and panfungal genome. So in our series, patients with culture negative yielded better outcomes vis-a-vis the culture positive patients, which implies that PCR helps in early diagnosis and targeted therapy. So it is a time for paradigm shift in endophthalmitis intravitreals, and therefore we should consider vancomycin, ciprofloxacin, dexamethasone empirical therapy, which substitutes the standard dictum of vancomycin, ceftazidime, and dexamethasone. PCR also allows early intervention, which is imperative to perform in all cases. So the limitations of our study is that it's a single center study having a retrospective analysis, and a large nationwide antibiotic registry is important. So to conclude, it is the largest study from Eastern India providing the latest microbiological trends. Pseudomonas species, which is the commonest isolate amongst the post-cataract surgery and endophthalmitis from our study. Ciprofloxacin is most sensitive for the gram-negative isolates, whereas vancomycin is most sensitive for gram-positive isolates. Polymerase chain reaction, it is the standard of care in the management of a post-cataract surgery and endophthalmitis. These are my references. Thank you. Thank you, sir. Thank you.
What is the dose of ciprofloxacin and
So
intravitreal and
yeah, so the one which we took was the standard one, 2.25 milligram per 0.1 ml. Thank you, sir.
And then follow with the Cipro itself.
Ma'am, pardon?
Drops. Do you follow up with ciprofloxacin drops?
Yes, ma'am. We gave ma'am moxi. Later on, when we were taking the patient for a follow-up, either we started with the OPD VCD regime again, or we gave the topical moxifloxacin or tobramycin, like as a follow-up for 1 month or so.
Is it
The intravitreal is what you are mentioning as Cipro.
Yeah, like ma'am, as follow-up, we did it later on for 1 to 2 months, but we used to follow up the patient every week, and then we started with the OPD settings. Instead of giving a VCD, like a vancomycin, ceftazidime, dexamethasone, we would give a vancomycin, ciprofloxacin, dexamethasone in the OT itself.
How is it different from the general management? What do people do generally? How is this more original than the others?
So the first thing that we actually saw is that the ceftazidime, which is usually preferred in an OPD setting, like vancomycin, ceftazidime, dexamethasone, instead of empirically giving that, we started with the vancomycin ciprofloxacin. The reason behind it might be the ceftazidime resistance which has come into play. And also there was a study by Jindal et al. It showed a temporal variation in the etiology. So maybe the organisms which are coming to play in the post-cataract surgery and ophthalmitis are changing over a period of time. So empirically, we need to be ensured that we are coming in terms of what is the common organism at this point of time, because 20 years before, whatever was the common organism might not come to play right now as well.
Okay, thank you. Thank you very much.
Thank you.
Just one point. If you feel that now ciprofloxacin is the one which is showing the organisms are showing least resistance, then why post-operative period you are using moxifloxacin and tobramycin? Why not continue with ciprofloxacin also? Why replace it with moxi?
Yes, sir. Absolutely, sir. Thank you, sir. So the basic thing is we obviously need a nationwide antibiotic registry. What we have is just from Eastern India. So what right now, like for instance, in our center in Shankar Netralaya, we are giving ciprofloxacin, but initially we were giving moxifloxacin and tobramycin. But for the last 5 to 6 months, we have started with the ciprofloxacin, and there has been no recurrence as such about infections as well. So we are trying to find out if topically also we can continue the same. So we are ongoing with the study at this point of time.
Because both are fluoroquinolones.
Yes, sir.
So it would be better if you continue same drug
Ciprofloxacin,
rather
yes,
than
sir.
changing the drug.
Yes, sir.